and welcome to Hope Channel Kenya, Light in the Family. My name is Kandio Diambo and this is Positive Living. So you're wondering, positive living? Positive living is basically the wellness of your mind, your body, and your soul. We will take you through living positively with HIV and AIDS and living not only positively but a healthy and productive life. For the longest time, HIV and AIDS has been a disease, a menace to our society without a cure. But technology has been working. God is good. There's been so many technological advancements, and there are antiretroviral drugs and therapies that help us to live with this disease and live healthily and productively. So joining me on set is a face that you will see very, very often. So please do get used to her. My guest is Brenda Kinyangi. She is a case management officer. She's a counselor. And on this show, she will be our teacher. So you see, she juggles all these hats. She is from Adventist Center for Care and Support. And we will look at everything to do with HIV and AIDS, from HIV and AIDS, what is HIV and AIDS, to treatment, to prevention, to mental health. So viewers, you really need to be with me on this ride. It's going to be a bumpy ride, but it's going to be a fun ride. So my friends, our friends from the lakeside, severing that head, I hear you call it the engine, the head of the fish, does not cure HIV and AIDS, but we'll tell you what you can do to live a long and healthy life. So Brenda, let's get to it.
Definitely. Let's
start with HIV. What is HIV? What is AIDS? What does those acronyms even mean?
That's a good one. HIV basically is human immunodeficiency syndrome, a virus, sorry. Then AIDS itself is acquired immunodeficiency syndrome. Basically, when you look at each and every definition that it has, there's immune in it.
Yeah.
Meaning that at the end of the day, it doesn't affect anyone, it doesn't infect anyone, but basically it infects us, and as human beings, not looking at if you're a child, if you're a grandparent, or if you're a pastor, or if you're a nun, you cannot get it. But basically, anyone can get infected with.
It does not choose.
HIV. Yeah, it doesn't choose. And basically, when you look at HIV itself, that is human immunodeficiency virus. Basically, it is the start itself of the virus in somebody's system.
Okay.
And basically it usually takes like 12 weeks when it attacks somebody. You might be attacked. The symptoms that somebody might be going through, they are not strange infections or illness that somebody might go through, but they are just normal illness and infections.
So a cough?
Yes, a cough. You might have a headache. You might get some fever. You might get some flu. It's still part of it. After 12 weeks, usually when you look at a graph, the graph usually starts from below coming up.
Okay.
Within the 12 weeks, then it reaches a point that is just stable. It means now that is the time the HIV virus is doing what? Replicating in your system.
So HIV causes AIDS.
HIV definitely, it is the baby of AIDS.
So you know, it's pretty cold. So if I get a flu, should I go get tested for AIDS?
It's a flu itself is a viral infection, and when you look at HIV, it's part of viral infection. I don't want to say that flu. When you have a flu, you have to go get tested for HIV, but it's just one of the symptoms that usually occur when somebody has HIV infection.
Okay, so let's rest on the symptoms for a minute. Tell us, you've mentioned an occurrence of 12 weeks before the disease progresses. What are the stages?
Actually, we have two stages of HIV. We have the acute stage It's acute, the way it sounds. It's something kidogo.
Yeah.
It's minimal. So it's the acute infection whereby it takes the 12 weeks period. Then after 12 weeks and above, we say like 2 to 12 years. We say now you are to 15 years. We actually say now you're in the chronic stage, whereby now we can be able to say now this person is getting towards the mother.
The mother AIDS.
AIDS itself, the mother. But you can be able to stay with the baby for as long as you take it positively. That's why today we are here with you, just talking about positive living. So you can maintain HIV as long as God is giving us life.
Yeah, because there are so many stories out there about
Very
people who have been living with HIV, which has not progressed to AIDS. So does this mean that it ranges for people? It doesn't have a fixed period for HIV to progress to AIDS?
Definitely it might be like that, depending with your immune system. Because I said HIV is human immunodeficiency. It means what is being affected here, it is the immune system itself. The more it keeps on being broken down by the HIV virus, it keeps on going down, going down, going down. The less it becomes so much down until whereby there's some tests somebody actually goes through until you are like looked at, you are below 500 according to the test that somebody goes through, CD4 count. Then we say now you need to be started on the ART itself. That is the antiretroviral therapy drugs.
So that is for someone who is quickly progressing to AIDS.
Yes, it will boost. But what actually usually happens today, any person who comes at the facility is being tested, you turn to be HIV positive, immediately you are being initiated into the ART itself, so that your immune level remains the same or even boost more than how it was. So
the earlier you're tested,
the earlier the better.
The earlier it's detected, the earlier the more chances you have to living healthily. Despite all these infections combating you left, right, center, because your immune system is now down and giving a doorway to all types of infections. So let's talk about symptoms. And you mentioned a flu could be a symptom. What else?
We have fever. I've mentioned headache. They are normal. They are normal.
Someone could be like, oh, I have a headache, I need to get tested. Is that, do you advise that? It's
very important. When you look at HIV, you also look the ways of transmission. Which are these ways that I can be able to get infected? If you have exposed yourself, it's very important to go and get an HIV test. So many people usually do IVCT. Like right now, you look at me, you see I'm healthy.
IVCT.
IVCT. I'm looking, she's okay, she's healthy. That's a good person to involve myself with. But you don't know even that person whom you're looking at, they're HIV positive. It depends on how they've perceived it and how they're taking good care of themselves, or even themselves, they are not aware that they are infected because they are living normally, the immune system is strong, they're eating well, they don't have stress. So what else?
You need to get tested, basically. And today, earlier on, my colleagues and I, we were reading something on HIV. And then one of my colleagues said, does that even exist? You see this notion, does HIV even exist? We do not talk about these things anymore. Since the inception of antiretroviral drugs, we think now that it's okay to do whatever we want. It's okay to be infected. After all, we have drugs. But prevention is better than cure. That is one thing we know. Prevention is always better than cure. Why expose yourself to something that will keep you on your toes, keep you on drugs every single time, something you could have prevented? So basically we will walk with you, and we'll know that if you're negative, please stay negative. But if you're positive, it's not a death sentence. So Brenda, let's talk about a cure for HIV. Why do you think it's taken our scientists such a long time to come across one?
According to Cambry, and anything that involves research, it still means it's something ongoing. I cannot, like right now, give you a specific, like there's a cure.
It's been decades.
What we actually have, we have the ART, which is the antiretroviral therapy that is there, the drugs. And it's part of combination of the HIV regime drugs that are there, just to help somebody to move on with their life as normal. Basically, what the drugs do, they just stop the multiplication of the HIV virus in somebody's system. It's like when somebody starts taking the ART itself in their system, they get in their immune system and like build a wall around the CD4 cells or the T helper cells inside the immune system.
So they're like blocking the virus.
Yes. So if they give some space to these T cells that are already there, what usually happens, if they give them time again to multiply without the HIV virus attacking them, whereby the more they keep on attacking them, they become like non-existent in your immune system. It means even we don't need to give you the ART itself, the drugs themselves.
Wow.
Because the drugs have to come, you have to take them when you have the cells. Yeah, the CD4 cells in you, so that they may be able to help the CD4 cells. If there were 10, they help them to, it's like zinazana. For them to be productive. And
that is what happens. The opposite, if you do not ingest these drugs, the virus also inazana
multiplies. Definitely. So it multiplies, whereby you get somebody who was living a normal life, a healthy life, from where his health or her health just deteriorates. They become weak. They cannot be able to bathe themselves. They cannot be able to feed themselves. They cannot be able to go to the toilet. Everything, they are being helped. We usually say now that is the time, we usually say the period of 12 weeks. It might be there. That is the acute stage. So this person is going through that without them knowing, assuming, hey, this is malaria.
And they don't know?
Yes. And they will take malaria drugs, and for sure somehow, because malaria is also somehow part of viral, it will work. They'll get again, they are feeling okay, it was malaria, and they move on with they move on with life. But if this person decides to go to a healthcare facility, they might be able, the initiation of an HIV test is going to be done. Then the person might be able to know, by the way, I've been going through this, and there's another time I also went through the same thing, thinking that ni malaria yuko nyumbani, kwa sababu nili travel, yet they find out that now I'm HIV positive, I need to take care of myself, I need to start treatment, I need to start eating a balanced diet, taking a lot of clean water, I need exercise. And
for the longest time, this disease has been on our necks. But now we know HIV is not as tough as you think.
True.
We have ARVs and all of these, amazing therapies. And you were talking, just before I cut you short, we were talking about, I feel like I have malaria, and I go get malarial drugs. And in the real sense, I have HIV, the virus. When do I know that I need to get tested?
Basically, what I will be able to advise people who are watching right now is just not to live in assumption. You go over the counter. We love doing that. Even me myself, sometimes I tend to do that. I say, this headache, I need to go get a painkiller. You go get a painkiller, and yet you are not dealing with the cause. You're not dealing with the cause of why the headache is coming. And if you go to a facility, they'll be able to take you maybe through the lab tests. and they'll be able to know, is this person having malaria? Is it typhoid? Is it pneumonia? Through the test that they're going to do. Then basically that is the point that somebody will be able to know, this is what I am going through. I am HIV positive. I need to accept. I need to start at. I need to start now living the positive
life.
Yeah.
And it's HIV. It's incurable for sure. Yeah. But you know, the ARVs and all of these therapies, like we're saying, the only way to know for sure to be on the safe zone is to be tested.
Very true. Very true.
Let's say I got tested 3 months ago. Do I get tested another 3 months, or do I wait for another 6 months? Is there
like a period for it?
Like a period, yeah. You know, the way cancer, for I know cervical cancer, there's after, I don't know, is it 2 years or 3 years?
Very true, yeah.
Is it the same with this HIV?
HIV, basically, I'll be able to advise after an exposure, that is, ways of transmission, unprotected sex with a person whom you don't know their HIV status.
Thank you for bringing that up.
You need to get tested.
Exposure.
Because you have exposed yourself. It might be through vaginal fluids, semen fluids. It might be through breast milk or blood itself. You need to get you need to go and get an HIV test. Another way, it might be through you shared sharp objects, maybe needles, syringes, with somebody whom you don't know their HIV status. It's also very important for you to get an HIV test. It might be through mother-to-child transmission, whereby I might be pregnant today. I'm healthy, I'm normal. Yeah. So I'm there, I'm expectant, and I'm HIV positive without knowing. So what happens to my baby? I also have, we call it a vertical transmission to the baby who is still in the womb. Then we have, you can be able to infect the baby when you are giving birth, or what I mentioned earlier on about breast milk. So it's very important for somebody to know all these ways of transmission, and also to know that immediately I expose myself, after a period of 6 weeks, I need to go for an HIV test. And for sure, if you get your negative, you are negative. From there, start maintaining your negativity status.
Stay negative.
Yeah. If you are positive, usishtuke, which kushtuka pia, it is normal. Yeah, it's very normal, but you'll get the best support from the facilities that are there.
You know, so let's say I've walked into a center and I want to get tested. Do you recommend going in alone or going with a support system?
I love how you're bringing it out.
Yeah, because I'm asking this because you've talked about exposure. So maybe najishuku, I exposed myself, and there could be a chance that I am positive, and it's no lie. It's incurable. It's for real. People think it's a death sentence, but it's not. Should I have a support system, or should I just walk in there?
Support system is very important. Support system might be within the facilities that you are coming in for to get an HIV test, and you've already known you're HIV positive. Support system also might be within your surrounding. That is your family, your loved ones. It's very important also to have support system there, because you might be getting used so much to me being your counselor there, until you don't have another confidant. So basically, it's also good for somebody just to sit down and really think deep. The reason why I'm saying this, I've gotten cases about this. Think really deep, somebody whom you trust, and then go confide your HIV status to, so that if Brenda is unreachable, you can still get help. Until now, when I become reachable, I get you're already on the way getting help as I continue to work with you as your counselor.
Wow. Thank you, Brenda.
Thanks a lot too.
We'll be going for a short break. Please do interact with us on our social media pages. That is on Twitter at Hope_Kenya, on Facebook Hope Channel Kenya. Leave us your text messages on our SMS line running down your screen right this minute. Let us know what you think. We'll be back shortly. Hello and welcome back to Hope Channel Kenya. You're watching Positive Living, and just before the break we were getting to acquaint ourselves with what HIV is, because this is what we'll be looking at, living positively with HIV and AIDS, and not only living positively as a person HIV positive, but also supporting whoever that is living positively. We'll be talking about treatment to prevention, to mental health, to exercise, everything you need to equip yourself to live a long and healthy life. So Brenda, just before the break, we talked about, stages of HIV. You're just brushing through just to get the gist of what all this is about. I would like to know, there have been so many theories, and I'm sure our viewers would like to know so many theories on the origin of HIV and AIDS. I don't know, it came from New York, I don't know, from monkeys in Africa, and for the longest time, Africans have been, subjected to, oh, you're the people that, caused HIV and all these things. Where did HIV come from? Where did this incurable disease come from?
Any time we it's like walking. You're walking in a desert that is HIV, AIDS. The animals that are there.
Well, I don't know where this is going.
So looking back,
looking
back from where it started from, basically I don't feel the importance for it. Because most of the time, what we usually encourage our clients is to look in the future. Because when you start looking at the past, the person will start asking, where did I get it from? Or did I go with this one? Or did I help this person? Because some people have been infected, but they've been infected in an innocent way. Without, some of them they've been sodomized, some of them have been raped, abused, and it has not gone so well with them when they think of how it happened. So when you look at HIV, I wouldn't want us to focus so much on where it came from. According to, if you Google some of the research that have been there, you see it happened in California, and they say California and New York, whereby we had men who used to have sex with men. It started from there. But looking at all this, where it came from the monkeys. I don't feel it's very important. But basically what we need to look at is here and now. This is HIV. How am I going to move on with my life with it? How am I going to walk and live positively with HIV?
So we could call some of these, things people try to explain the origin as myths.
Yeah, they are myths and misconceptions. Obviously, they're there.
So many. As human beings, we tend to create things that add up to things we do not understand, and HIV is one of these things. So people tend to make up, no, this is it, not that, and that's myths and misconceptions. Is there something else that has as many myths and misconceptions?
But it's there, like what you said about eating the engine, fish, that's also part of myths and misconception, that if I eat it, I know I'm infected, I won't go for treatment. Another myth is you're bitten by a mosquito. I'm HIV positive. It comes to you, say, oh my goodness, Brenda has infected me with HIV.
How do you know that mosquito that beat Brenda is the same mosquito that beat you? You see?
So those are things that are going all around, and we are here
Yeah.
Basically, I believe the show is about that. We need to clear all this as we work together with
that
our
is what
viewers
we're
on
doing.
this. Yeah.
So I think we can just touch on some myths and misconceptions and just say, no, this is the myth, but no, this is the fact. Please walk us through that.
When you say that you are sharing a toilet with somebody who's HIV positive, you don't get infected through such a way. Even sharing bathroom, you can't get infected through such a way. And also another way is when you are using, some people tend to say like we are sleeping in the same bed. There are different types of sleep. It's when you're having sex is different from sleeping. We need to clear that.
Yeah, please.
Because people say, "Hey, Brenda talked last time and say sleeping in the same bed, you can't get infected." But it's the truth. So long as you sleep with an HIV positive person in the same bed, it doesn't mean that you'll get infection. You only get infection when you have unprotected sex, and through the ways that we said, it might be vaginal fluid, seminal fluid, it might be through blood transfusion, it might be through even the breast milk. Those are the major factors that you can be able to get HIV infection.
That is through unprotected sex.
Unprotected, yeah.
So let's say, for instance, I have sex with someone and I decide, let me go bathe or let me go wash my, and so I will not get the virus. Do we consider that as a myth?
Yes, it might be. It's a misconception. It's not a myth, it's a misconception. Because basically it's like when we advise somebody who has gone through rape, we advise them, please don't bathe. Make sure you report the case within 72 hours. Come, we do some vaginal examination. We swab, we take some samples. You see, like that one is a different case. So even bathing doesn't remove you getting infected. Because at the end of the day, even this person who comes, who has been sodomized, who has been abused or raped, still they are being put under the PEP itself to avoid getting infected.
That is, the PEP is the
post-exposure prophylaxis. Because it means they have already gone through it with somebody whom they don't know their status. And it has been through unprotected sex. I
think we'll touch more of that on the next episodes, right? What about tattoos and piercings?
Tattoos and piercings, also when you look at it, basically it falls on use of sharp objects and syringes. So it's very, very important. When somebody that you have exposed yourself like that, or you are thinking of going to expose yourself, know there are chances of you getting infected.
Wow.
Unless those things you confirm, it's just like kinyozi. When you're going to the barber.
Oh my God, yes.
When you're going
now
to
you
the
make
barber
people
shop.
Paranoid.
When you're going to the barber shop, you have to make sure I cannot be shaved and immediately you sit down and you start getting shaved. And
what if you're the first customer in there? How do you know for sure?
You make sure they clean it. They have those things there for cleaning them.
You'll tell your barber, please clean this while I'm watching.
And they will do. And they will do. Me, I've seen it. I've seen it through, these big salons that you enter. There's a barber shop here and salon here.
The 5 stars.
It's your right. It's your right because you're paying for the services.
Yeah. And better...
prevention is better than cure.
Exactly. And apart from those myths and misconceptions, there's also the fact that if you eat from this plate and I eat, and you're a person living with HIV and AIDS, and I eat from that plate.
Very true, yeah. Very, very true. It's also there, and it's so sad.
It's sad.
It's so sad because it's part of stigma. And that's why we are here by the Candy, to clear all this.
Clear all this. Yeah.
Clear all this so that even when, even us, like me, I'm in the HIV world. Some of my friends, very close friends, are going through it. And I usually say, when you look at yourself within your family, lazima there's somebody who's infected. You might not know, but there's somebody within your family who is infected.
Thank you for bringing that point up. Because there's also this myth that you see someone walking and you're like, that person is positive. Why do people think that? How do you know? How do you just see with your naked eyes and you think someone is positive?
That's why you see I started earlier on by saying that is eye visiting.
Yeah.
You know, I look at you.
And it happens.
Huyu hana. Huyu ni mzuri, and yet you start judging somebody who's like slender, his health, they are malnourished. You are saying them, they're the one who are HIV positive.
And that person is very healthy, perhaps.
And yet I've had such an experience, and also through my practicing as for all the years that I've been practicing, that sometimes you get to test that person, you get maybe they are going through, maybe it's they're having problem with their kidney, their liver, so it's bringing all this, even cancer. So you can be able to, if you are not careful, you'll judge this person is HIV positive, but they're not positive. They're just going through another different disease.
Please
tell
us something about this experience you're talking about.
By that, basically, I can be able to say it's very sad. Out of my experience, especially I usually say all HIV positive clients or patients, they need to thank God. They need to thank God that they've known that they're HIV positive, not when they are bedridden. If you come to a facility, you get tested, you get to know that you're HIV positive, start living positively. Maybe I'll just be able to share about a client, but I won't be able to mention the name. A male client around 35 years came to the facility, had issues that he was not feeling well, and he came in. When you're sitting down, he was not sitting. You know how you sit down, you go, you just put yourself down and you sit. But him, he was just sitting pole, holding himself, trying to get the best posture that he can be able to sit because of the pain that he was going through. Then I just happened to probe, by the way, what's wrong? How are you feeling? You're not okay. And I say, I'm feeling unwell, I have a boil. Where do you have a boil? I have a boil in my anal area. So, and have you gone to the hospital? No, it has been started, and I think I can handle it. Again, I said, I don't know how you feel if I ask you this, but don't get offended. But have you ever undergone through an HIV test? Client he went quiet. Then he said, I went, but I'm not happy. I went and I don't want to talk about it. They are like, what happened? We can also do it here. We have the devices here. It's still confidential. We can still do it. You get to know your status. Then I'll be able to refer you to the best facilities we have here or where you are, near you, so that you may be able to get the best treatment, even for the boy that you have. Then he was a bit hesitant for a while, and he agreed. We did with him an HIV test. He saw his results. He saw that he was HIV positive. And we talked about positive living, that is eating balanced diet. We talk about cleanliness, because you know, even if you're HIV positive, you need to clean yourself. You need to take a bath. We talked about clean water. We talked about exercise, which he said he walks, which is still exercise for according to how we agreed with him. Then basically I had to refer him to get, that is the care, the art itself, the antiretroviral therapy. I directed him to where he's near the facility. Basically, if he's not comfortable in where we are at the facility, I cannot force the client then stay within our facility. So he basically went to a facility and he was supported. His immune system was low.
At that time?
Yes, it was low. That's why he was getting attack of boil. That was not the first one. Attack of boils, one area after the other. So he basically went to the facility. He was given something we call the CTX, which means Septrin, the antibiotics. He was given also some some nutrition support.
Out of the airways.
Yes, some nutrition support. It's different. That is basically food or something just to boost the immune system. It's called the supplements. And he started taking them, and he started doing well. Then he came back. He told me, by the way, I've been given
After
this.
how long was that?
Like after 2 weeks, he came back. Told me, I've been given this, I've been taking. Now look, the boilers, it has disappeared. That's how when
After
drugs
2 weeks.
when you start taking, even after a week, depending on how you can be able to adhere to the drugs themselves. So he came, told me that he's doing well, and the boilers disappeared. Then after a while, he disappeared. For almost a year. Then I said, maybe I've done my part. If it's God's will, God take care of him. I hope he's taking now drugs so well. Where he's going. Only later on, he came back.
After about the year.
After the year.
Oh my God.
And shock on me, he came back and told me, by then, do you know what, Brenda? Now I am married. My wife is pregnant.
No.
So he's just pouring everything on me. I'm like, okay, that's
Then he
good.
was not married.
That time he was not married.
Wow.
So I really, really encourage any person who's HIV
How
positive.
did you feel?
It's challenging. Being a health service provider is not easy. Sometimes you tend to go and ask yourself, what didn't I do right? Where did I fail? What do I have to change? Or it's not me, maybe it's the client who just decided, now I'm feeling well again. No more infections. The drugs are working well. I stop.
But this
Then I
one
start.
came back.
Yeah, and start again marrying. The only challenge is you get the person marries and they've not gone for an HIV test. Meet somebody like you, Candy, very beautiful and lovely. You see a gentleman, neat and healthy, yet they know they're HIV positive, but they don't let you know that they're HIV positive. You start a relationship, you become pregnant. Imagine, Candy, when will you know that you're HIV positive?
Wow.
You just look at the scenario.
Yeah.
If it's you, when will you know you are HIV positive?
Perhaps you start getting, sick and all that.
No, the only way you'll know you are HIV positive is when you go for your antenatal clinics.
Yeah.
Then you are surprised there, I'm
And you're
HIV
tested.
positive, and you're expectant.
Yeah.
And the baby is there, growing in you. So I just like to encourage any person who's HIV positive, getting married, having relationship, it's awesome, but they need to follow the right steps. They need to bring it out to the partners that they love.
Yeah.
Because I believe when somebody loves you the way you are.
Yeah.
Yeah. You bring everything on board.
Regardless.
Yeah, they love you the way you are, regardless of your weaknesses and your strength.
What would you advise our viewers based on that story?
I would really encourage them to, anytime you are starting a relationship, just to go for an HIV test. As fresh as it is, just go for an HIV test. You might get like, we are not planning to have sex. I've not said that getting an HIV test is about having sex, but it's just good to be aware of this. This is something that is happening around us. Our loved ones are going through it. Others are going through stigma, because us ourselves,
which we'll talk about.
Yeah, even us ourselves, we are stigmatizing around people, so they are listening. They hear, hey, you despise HIV positive people, and here I'm your auntie, I'm HIV positive. I will never let you know, because I've already seen your perception on people who are HIV positive. So any person who's in a relationship, starting a relationship, I'll kindly encourage them, first of all, to go to a health facility, get an HIV test. Now it has already been rolled. Also, we have self-testing. Somebody also can be able to do that. Okay. But come together as a couple to a facility. And you'll get the best services.
It's
confidentiality
better,
is there. Confidentiality for sure. It is there.
Wow. Thank you.
Thanks a lot, too.
Our time is up. And just to finish, dear viewer, I would like to read something. This is an experience. You know, something I love about this show, we're talking about real things that actually do happen. And this is what someone says. Today, I know that HIV lives and grows of fear. The fear of rejection, the fear of a shorter life, and not being able to achieve your dreams. But being positive is now the most positive thing about my life. Is that not wonderful?
Very, very, very. I don't have even words to. That's great.
I did not plan this, by the way. That story, it's similar to this one. You know, the guy found happiness despite all that. So it's not a death sentence to be diagnosed positive with HIV and AIDS. Please do stay tuned, and you will know more about living a long and productive life with HIV and AIDS. Remember to interact with us on our social media pages. That is on Twitter at Hope_Kenya, on Facebook Hope Channel Kenya. Send us an SMS via the line running down your screen. Let us know what you think. Let us know your experiences. Inspire people out here. We need to know. We need to be aware.
Very important.
Please join me next time. I've been your host, Candy Odhiambo.